We know from the TILDA study that 65% now of our over 65s are living with 2 or more chronic conditions. The HSE set about addressing that problem and seeing what could be done to improve it. And what they did was came up with the Integrated Care Programme for Chronic Disease. And what that did was to harness the power of general practice to see what we could do to help patients and streamline the process and ultimately improve their health and reduce, hopefully, the impacts on the A&Es and the hospital admissions. This initiative has set about asking GPs to identify the patients who attend them with these conditions and bring them in and optimise their care each time at those 2 reviews. You're talking about 4,000 GPs in 2,000 GP surgeries, and that's a lot of people seeing a lot of patients, so it has a big impact across the population.
The solution incorporates a suite of intelligent tools, triggers and workflow enhancements designed to assist GPs in efficiently scheduling and managing patient reviews.
General practice will actually see 29 million consultations per annum. So when you bring an initiative like this into general practice, it means that there's an army of people approaching the problem, so it has a huge impact right across the country.
In a lot of instances, people aren't acutely unwell and can be managed by their GP with some additional support from community-based services, which is where the idea of the Chronic Disease Management Programme in general practice came, and obviously then the community specialist teams, which are now up and running across the country.
This project is a real model for how to deliver a solution like that, where you're delivering care more out in the community and away from the acute environment.
Patients are living better with their chronic disease because of the care that they're being provided through general practice and the Chronic Disease Management Programme.
97% of GPs are now involved in this programme, so it's right across the country. Major reductions of 45% in blood pressure across the length of time they're enrolled. Physical activity improving also by 45%. There's been a sustained drop in admissions of 16%, way above what would be considered normal right across the rest of the country. So a huge impact in that way as well. Really brought the HSE and general practice working together in unison and in lockstep, and it's having a massive impact on patients. It's a really wonderful initiative to be part of, and I'm thrilled that we've won this award.